Good morning, folks, and welcome to our continuing education session on traumatic grief related to suicide. It's being presented today by the Reverend Dr. Peter Burns, the Coordinator for Bereavement Services with Eastern Health. Peter, thank you for putting together the presentation, and I know you have guests that you'll introduce as we move through the session. So thank you, and I'll pass it to you, Peter.
Great. Thank you, Rick. First of all, I want to introduce Andy and Marilyn have already given their names. They are here. I've invited them to be here because I want this to be a real experience for all of us. And Andy and Marilyn have been very much out in the community in relation to the tragic death of their son Louis. And that's so I want to bring the real dimension, because the nature of the work I do, I see a fair number, I think it's a fair number of people who whose loved ones have died by suicide. And I know how I've struggled from the time when I was first ordained and appointed to the parish of Channel in 1974, that was. And in the summer, I can remember I can remember vividly a woman who took her life with a gunshot, and how tragic that was for her husband and 14-year-old son. So my history with people who've died by suicide, I've gotten to know a lot of people who've died by suicide, and that's what I tell people, is I get to know your loved one very well, even though I've never met them. And so I want to explore and to encourage your creativity and your ability to be present with people who are surviving suicide. So, Rick, do we have a flicker, or are we?
I'll get to it in a second.
Okay. Just the technical difficulty. I want to hold it there at the silence, Rick, please. Go ahead.
Is that you need me
I
to
want
go
to go
back?
back to the silence, the slide before that. Yeah, that one there. My assumption is that you are all people of prayer, and the deanery meeting has already begun with scripture and prayer. I believe, out of respect for all who have died by suicide, and also out of respect for ourselves, to take a moment to go inside and just feel the presence of yourself, the presence of the vastness and the awesomeness of life, just to be respectful of yourself and of others. Thank you for that. When I just took that moment myself, my thoughts went to people that I remember. Maybe that was true for you as well. That there are so many people, so many lives that we touch that become so real to us and are so significant to us. Now all I have to do is remember how to use this. Whenever I use these, I end up going backwards. So you'll see every slide at least twice.
This one here.
That one there?
Bring your head. Yeah.
Okay. That one? No. Okay. Okay. I want to begin with an assumption. who you are and what you've experienced. I wasn't sure exactly who would be here, so I assumed that there'd be some volunteers here, some pastoral ministers, and some healthcare professionals. So maybe with mixed backgrounds. I know Derek certainly has been a healthcare professional. We've worked together at the Waterford for years, and that was a great experience. So knowing some of your backgrounds and knowing that that we come together maybe as also a dimension of interprofessional aspect to it as well, and also to consider your life experience, that you have been impacted in some way by depression and suicide and trauma. So am I assuming, is there anybody else that I haven't that I haven't touched on in those? So I got some sense of who you are. This is the purpose that I've listed. Rick alluded to the fact that I welcome every opportunity to explore topics that are certainly of great interest to me, and I think a great interest to the community. And so I invariably often bite off more than I can chew, and that's why I need clergy wellness as you need clergy wellness. And so in terms of the purpose, I want to especially address the first one, the care of families and friends of suicide victims. And I'm sure we'll get to the other two in maybe in indirect ways, but I'm certainly wanting to put the focus in this session on your learning and your experience and our sharing. And that's why I've asked Andy and Marilyn to be here. Background information. I checked with the coroner's office of Newfoundland, Labrador, and learned that there were 61 suicides in the province last year. My gut tells me there's going to be more this year. I just have a sense that the number of people, the referrals that I'm receiving certainly are indicating that there is more. And so I think it's a very timely topic for you to be requesting. I want to, as you see, I'm not always coordinated. I want to reference, we're not capturing men's suicide statistics accurately. And that's a quote from an article in the Lethbridge Journal, I believe it is. It's a paper in Lethbridge, Alberta, that quotes Peter Kellett, who may be known to some of you. It's Neil's son. Many of you know Neil Kellett, retired in chaplaincy last of all, I think, and from the diocesan office. Peter is a researcher with the University of Alberta, University of Lethbridge rather, and so I quote that we're not capturing especially men's suicide, and so that makes us realize that in terms of car accidents and drownings can also be suicide, but yet they're not captured that way. So the statistic of 61 may be in fact lower than is the reality.
Peter, can I ask a question?
Sure.
Why the distinction between male and female? Why the difficulty in?
Well, that just happens to be the quote that I had.
Oh, okay.
So
No, just curious.
I think from my time at the Waterford, and Derek might very well be aware of, or more aware of this than I am, and my time at the Waterford, my sense was that men often complete on the first try. Women tend to attempt suicide, and it may be the fourth or fifth attempt before they complete.
One of the things that is established in some of the literature is that the means to suicide for men are often quite different, because it just makes common sense. People will use what they're used to. So on average, I would say more men use guns, they're probably more inclined to be handling things where they're handling ropes and different things that are make it practical to use kind of household things, or I suppose guns are not altogether household, but at least they're not uncommon in a lot of households. So they'd have access to the means. So that's one distinction that's made in some of the statistics around suicide in some jurisdictions. But Derek, you're going to...
I believe that Peter's research was specifically for the males.
Yeah.
So that would, be obviously the reason he couldn't comment probably on females. But I'm agreeing with Rick. Men, we always saying in mental health, men took more lethal means, guns or hanging, those are a lot more lethal than a drug overdose, which it seems as if women do that more often. And people who overdose on medication can often be found before they actually pass away. Whereas, if you use hanging or a gun, it's very rapid, quick, it happens now.
Thank you, Gene, for that question. So why are you here? The purpose that I listed a couple of slides ago, does this meet your expectations?
Comment?
I just asked a question. When you ask a question, you got to be open to answers.
Well, for me personally, it's sometimes the person that you felt was least likely to commit suicide is often the person that does. And it can be very difficult if you've worked with a person, especially for a period of time, and you feel that you've helped them and they've acknowledged that you have helped me. And then afterwards they end up completing suicide. And that's very difficult because I think at that point you feel as if you failed that person in some way. And obviously that has an effect upon us. But you need, I think, to come to the realization that people make choices. And we can't always be, responsible for those choices, right?
Thank you, Gary.
For myself,
Yes, David.
The reason I was interested in this topic is that chatting with colonels who do extractions of bodies from different places, and then telling me about all the different suicides that they go and bring the body to the morgue, and realizing that as a priest, I'm not doing the funerals, and I'm not being called for pastoral care, and I know that there's a disconnect between the spiritual comfort, pastoral comfort that I, as a priest and pastor, can offer, and those who are seeking comfort, and the illusion that the church is condemning and saying that person's in hell, and I don't think that that's the case. But where is the disconnect? How can we not only be involved with the pastoral call afterwards, but be involved in the intervention beforehand, if that's the case?
Exactly.
And how do we change the perception, perhaps internal, perhaps external, of how we approach this topic, so that it's not a judgmental approach, but more of a pastoral approach. How do we reach into our community and say, this is people who are hurting, and God hasn't forgotten, and we're going to try and adapt, change, our perception of how we deal with this. That's why, for myself, why I wanted this session.
Great. That's very helpful, David, and very honest, and I appreciate that, your clarity there. Anyone else?
I came out of interest. I'm a student at Queen's, yes, a very elderly one, I admit, and I was a counselor and taught psychology for a long time at what is now the College of the North Atlantic, and I did a bit of suicide intervention with the students there, the young people. But I'm mainly here because one bright October day, 25 years ago, my husband killed himself. So I have the same interest as Andy and Mary Lynn, I know. But I just came out of interest to listen to what you all said. Thank you.
Thank you for being here. This is, yes, Andy?
I guess, I have no idea what we can do, but if there is anything that we can do, and I'm sure feels the same way, I hope we can, give some insight or whatever, and I feel very strongly that I want to do something because, his name or whatever, and Louis, our son's name was Louis, in his name, because he was very interested because he had mental illness and he had talked a lot about his concern for other people. It was a very, very big part of his, to some extent, his worries, his mental anxiety. But I hope that, I have no idea what we can do, but just to say that we had been there and hopefully we can, give some insight.
Hear, hear.
Yeah. And it's wonderful to see that a lot of you are representing churches and that the church is looking into this and embracing it in some way, because you're right, there is a stigma about, suicide that is alive and well, but it's certainly on the radar like it's never been before. And it's great to see that you're listening. And yeah, there is a disconnect, and it's great that you're looking to change that.
Thanks, Mary-Ann.
Yeah.
Oh, Sandra.
Peter, for me, I've always had I don't know if interest is the right word, but a connection with wanting to know more about suicide individually, but also as a priest in the church. As a newly married mother, pregnant, one of my best friends committed suicide at that time, and we had gone all through school together. So he was a very young man, just 21. So exposed to it from then, and I've carried that with me all my life, because at the time I was not able to be at his funeral, so it was as if I never had closure. And so 40 years later, still he is constant in my mind whenever suicide or anything arises. And as a brand new priest here at St. Thomas's 24 years ago, in my very first months had a suicide, and was thrown right into working and helping as best I could a family, and knowing how much that was appreciated by them. And the wife happened to be Roman Catholic, and to this day I can still run into her, and what all that journey meant to her, just walking with her. Not that I had any answers or anything, but and that's what she remembers and talks about, the just being there, and the one set of words I used in the midst of everything that she has hung on to for years. And so it's a reality of our lives with those who do commit suicide, with the families of the people who do, are sitting in our pews on Sunday morning. So always just wanting to be aware and knowing how to connect and relate. And we might know some, but it's such a drop in the bucket that we need to always know more and be empowered more. So I'm just very happy that we're doing this today.
Great. Thank you, Sandra. So,
hello, Peter, we're online. Can you hear us? Can you hear me?
And thank you.
Okay, Linda Budden here with Janet Pardy. We have no video, so would it be okay if those who are speaking would identify themselves first? We might know them and be able to get, where they're coming from.
Sure, Linda. I'll ask.
Okay.
That was Sandra.
That was Sandra. I knew her voice, and I think I heard Andy being said, Andy, so we knew it was him. It would be helpful. And I guess the two of us are here because we know out in this area of Conception Bay North there is a great need for all we can learn about this, and there's going to be a greater need, as you said earlier. So thank you.
Great, Linda. I'm glad to hear you're on, and hi, Janet, as well.
Hi, Peter.
Hi. So we're going to have some, or we are having some really interesting sharing already, and I want to affirm that. And so what I want to do now is go deeper into the experience and what we all need to be aware of, whether we are friends or family or clergy or whoever. What do we need to realize in the grief process that may help us go deeper than ordinary? That, you know, if we are repulsed, if we are anxious, if we are awkward with death by suicide, then we need to address that personally. We need to address that ourselves so that we can open space and help people to better come to terms with what has happened. If we can't be a vessel that receives others, then it's like we're already a full vessel, and people pick that up. They pick up our discomfort, and I think that's what you captured it so well, David, earlier, and I appreciate that. And so this is part one. And what makes suicide grief different? Traumatic aftermath, stigma, shame, and isolation, mixed emotions, need for reason, what if, and risk for survivors.
Guilt. It's not there.
We'll get to, in all grief, there's guilt. So I guess what I'm focusing here is and it can come in under mixed emotions, but I want to focus in on the trauma, because I think all suicide is traumatic, and the stigma, shame, isolation that goes with it, mixed emotions like guilt, need for reason. What if? You know, like people are discharged from the psychiatric assessment unit and complete suicide. Like, how do we make sense of this? If only they weren't released. It's just so difficult. And the risk for survivors. We have to be aware of the risk for survivors. We know that people who are grieved by suicide are more at risk of dying by suicide themselves than anybody else. So are we really paying attention to that? Are we really caring for people who have had loved ones die by suicide? I want to share this quote from Dr. Peter Levine, and he's created a therapy program called somatic experiencing. So you work with the body to address trauma. And so he says, as in the biblical story of Jonah, the unknowable forces of trauma and loss can swallow us whole, thrusting us deep into their cold, dark belly. Entrapped yet lost, we become hopelessly frozen by terror and helplessness. That's profound. And those of you who have been immobilized by the shock of being, like I referred to the suicide in the first parish I was in, like I would have been 25 at that time, I think. And I can remember walking into the house and seeing blood all over the ceiling. And like I can remember going back and visiting that family. There was a man and his 14-year-old son. And he was making supper for them. And I always remember, he said, "Going to stay for some supper?" I said, "Yeah, what do you got?" He said, "Fish peas." I didn't know what fish peas was, but I knew I was going to have to eat it. Like that was the way it was. Like, because I knew he was lonely. He was so obviously lonely, and this 14-year-old was so awkward. You know, his mom had shot herself. like just so horrific. And so we've got to be aware of how that affects us as well as the family and friends of a person. Now I see young men who come whose buddies have died by suicide, and they just melt because they're traumatized by the event. They're horrified what has happened. And so if you hear nothing else today, be aware of the trauma that can happen, can affect us. So that's a quote from Peter Levine, like I said. Building on that, be aware of trauma risk, the risk of the effect of trauma due to death by suicide, and the risk of becoming stuck. People become frozen. And this, one of the ways that I've become so interested in trauma is because when I meet with people whose loved ones have died by suicide, or sudden death, sometimes it can be shocking, shock a person's system. And when I see that, I see them going over and over and over again. The memory, they're replaying that moment when either they found them, and that often is the case, they found them, or they imagine the person being found. Sometimes it's not appropriate to have an open casket, so people imagine, and that can be just as horrific as actually seeing the result of the suicide. So those disturbing images, people are stuck in that. And so it's not enough to say to those people, get over it. That's very inappropriate. They can't get over it, they're stuck. And that's why you need to understand, and I want to draw attention to your scope of practice. You can't be expected to be able to treat that person's trauma. That's beyond your competencies. And you need to be respectful of, but to be aware of it. So that when you may feel helpless, I feel helpless in those situations. I can't fix them. I'm a fixer. I can't do it. I can pray for them in a contemplative way, and I do. But the challenge of being able to listen and hold a space for them, and you know, I hear some of you knowing that that's what you do, and I praise you for doing it because that is so important. You do have the capacity, you do have the competency to pray and to hold space, to open space, to create sacred space for someone. And that I commend you for, and that I encourage you to grow those skills, but also be mindful of the need to refer, because trauma is a critical piece of all of this.
Peter, David Burrows.
David, yes.
David Burrows here. I'm really encouraged by those statements because I've only encountered in my pastoral ministry suicide twice. And I've never been the primary pastor because I've always been involved in multi-staff team ministries, and most of the time I'm the junior, or I have been. But the aspect of referral and enabling that to happen is so important as I see it, because we're in situations where we deal with levels of grief within the parish, outside of the parish, in so many different ways. But by suicide is very, very specific, and we can't hold on to that skill set nor that focus when there's some other people who are doing that very, very effectively, counselors and others. So I see that as being very, very valuable. I also see that piece around creating a space. I think our parishes, our faith communities, need not just the pastor, but the faith communities have to find the space as well. Because sometimes it only becomes the pastor who is creating the space, and so then The person only can find a space within that interaction. But I think it's upon us to encourage our faith communities to say, okay, how do we create a space for traumatic grief for folks who are dealing with suicide?
Thank you, David. Well said.
I'd just add to that, I don't know, Peter, it's what you intend, but I see the need to underscore that when people in ministry refer someone or suggest they see somebody with more specialized skills for complicated grief, as it would be in most cases with suicide, that the referral shouldn't be passing them on lock, stock and barrel, that it also has to, the spiritual component, the pastoral component will always be needed as well. There may be people who have a good skill set to help people with those complicated matters, in the dealing with the trauma, but in some ways you can almost imagine somebody who's severe leg or foot injuries that trying to help them along on one side or the other only is much more difficult than having someone to try and limp them along on each side, we might say. And in a crude kind of way, that's the image that comes to my mind. Someone may be referred to a psychologist or specialized grief counselor, as Peter is, or a psychiatrist or others, as far as that goes. But that support for the pastoral side of it is so important. And then that spreads out, as both Peter and David has mentioned too, the broader faith community brings tremendous resource in numerous ways, socially and spiritually as well. So it isn't, just want to underscore that, referring on doesn't, because the person you're referring them on to would probably admit that they are just as deficient in most cases with the pastoral and spiritual skill set that's a great resource for people in times of intense grief, regardless of the type of loss.
Can I just make a comment as well? I want to pick up on what David had said earlier about, how can we be more effective in addressing this real, life and death concern. And I think really what we're talking about, and what we need to continue to focus on, is collaboration.
Exactly.
You're right. I mean, when we refer someone to a professional, we're still part of the team, so it's that collaborative effort. I think our churches need to be offering more outreach, more probably, sessions or whatever that deal with mental illness, that deal probably with suicide intervention, all those kinds of things. And I know at St. Peter's that's the line that we're moving towards, offering more and more of those sessions, so that people get to know that this is a church that's open and welcoming and aware and interested in heightening the awareness of mental illness. So, that's what I'd like to say about the collaborative piece.
Thank you, Jean. That was Jean Smith. I couldn't remember if you said your name or not, but that was Jean.
Okay.
Thank you. The word is collaboration, and thank you, Rick, for emphasizing that, and David for beginning that discussion, because it's so important that we all feel parts of teams, and that the church or faith community feels a part of a team as well. So these are the various feelings that accompany grief by suicide: anger, guilt, disbelief, numbness, blame, despair, shame, relief, disturbed sleep, and denial. But I want to focus on the confusion and the disorganized. And Andy and Mary Lynn, I'm sure you identify with many of these words. People feel like they're losing it. Like confusion. The confusion is indescribable. It's so severe at times, and the feeling that disorganization. Life has just been turned upside down.
And I was actually, Peter is my grief counselor, so I'm still seeing him in almost 3 years, 2.5 years now. But I was talking about this yesterday, and it's sort of a hard thing to explain sometimes. But I have always had a kind of ability to sort of kind of dream my way out of the confusion of my life. So I think, I've got this thing happening next week and that, and we've got this problem, and all these things, as everyone in the world does. And I just had this thing where I could go and say, okay, and I would sort of get a little plan. And my plan would be, okay, what if I say to this guy, I can't do this till next month, and what if I, get up early in the morning for 3 mornings in a row and do that? But I didn't have to do those things. Like, once I got the plan in mind, it gave me a kind of relief, and I was able to carry on. That's just something, and I guess everyone has some version of that kind of ability to focus down. And like I say, the plan didn't necessarily have to happen as long as I could get to that point, and then I could move on. And I have never been able to do that since Louis' death. It's 2.5 years. And I try and try and try to get some sense of how I can make some sense of the world. And I do lots of stuff. It's not that I'm not feeling sad all the time either. By any means, I'm able to do things, but overall, I have that inability to move ahead, and it is often, I guess, coupled with a kind of depression that I have never had before, even though I am able to. And even though we've had wonderful things happen in our life, we've had a grandchild born since Louis' death, just 6 weeks ago, so like that was such a big, wonderful thing. But it's so funny that even in the face of that, the depression and my inability to get ahead, move ahead, is still there. Maybe that's what we're talking about. Anyway, that's something I feel stuck. That's what. And then Peter said, I brought this up to Peter yesterday, and he is, used that thing saying you're stuck, and that's something that is, I guess, an aspect of.
It is funny. I didn't feel stuck for the first couple of years. I'm definitely stuck.
Yeah.
Pretty stuck. Sorry. I'm feeling stuck.
Yeah. It's funny that in many ways, the first year wasn't as bad as the next 2 years. I don't know if you found that.
Yeah, it took me 2.5 years, but my experience was completely different.
Yeah.
I wasn't confused or disorganized. It made me more focused. I was totally focused on getting the administration, the estate, and doing the estate and all that. And it was like it gave me a clarity about the past life with him and what my life was going to be in future. I've been confused lots of times in my life now. Hey, don't get me wrong. Confusion is sometimes my middle name, but it wasn't confused about that. It was like a light went on, and I had to do certain things. And yeah, I've often been stuck.
I was able to function, and I functioned so much better at the beginning. It's almost like, that thing of when you're at the funeral and you have this role,
Yeah.
you have to kind of help everybody else get through this because, you're the principal, you and your partner are the principal people in this situation in some way, just as the person who died. And so therefore you have to do that, you have this big job every day, you're accompanying everybody in kind of way, even though they're accompanying you too. But it was later on that I had that, and I don't know if I'm still able to do things, but it's just that feeling that it is debilitating in some way. But the interesting thing is that what you described as being that clarity was the way I felt when he first went into the Waterford. And I remember I didn't experience depression for 3 years after he went into the Waterford. It was like I was shot with adrenaline. I was thinking, gosh, I haven't really been feeling depressed. Because I was like, my mind was, oh my God, like, what are we going to do? What's going to happen here? It was such a, not that it was exactly a shock, because I sort of was thinking it was going to happen, but, the reality of that was so shocking that I didn't. But I guess the suicide, also the death of your child, and so on, all those things.
It's worse because my husband was in his mid-50s, he'd lived a life,
Yeah.
and so on, where Louis was so young. Also, Cal Reynolds wasn't mentally ill. He had extreme anxiety from medical and legal problems, but I would never have classed him as mentally ill or depressed. I think on the last couple of days he might have been somewhat depressed, but it's always disturbed me that the words mentally ill or depressed and suicide are used interchangeably, and they're not. He was quite rational, actually.
Yes, well, Louis was mentally ill, but he was quite rational.
He was quite rational,
His
too.
life, he knew what he was doing.
Yeah, I think that was true of Cal too. He knew what he was doing. There was no doubt about it.
And in that way, we gave him that by talking about his suicide in the paper and getting it out there. Because he owned it in a way. He was planning it in hindsight. We thought little things that made us realize, okay. But he was putting himself out of his pain. So he knew what he was doing. But there's a lot of suicides where it's more of a spur and no one sees it coming, and I mean, there's just so many levels to it, isn't there? So everyone's is different.
I remember one time I was facilitating a support group for survivors of suicide, and there was a young man there, and he was very quiet, so it was probably, we were doing 8 sessions, so this was probably the 5th or 6th. We were well into the program. And many of the participants in the group were parents or partners of people who had died by suicide, and I would say all of them were very tormented by what probably describe it as guilt, but particularly that sense of what they should have said or shouldn't have said, or what they should have done and shouldn't have done that would have made a difference. So this young man, he was very quiet. We would have structured the group that I would have. I'd have a check-in and a check-out at the start and the end of the sessions. And when it came to the check-out in this session, he said, I've been here from the start. He said, I haven't said much. He said, but I really enjoyed, hearing what you all have to say. But he said, today I want to share something with you. He said, in the few minutes that we have left, he said, I'm here, he said, because my partner died by suicide. But he said, I also attempted suicide, and he held up his sleeves, and I mean, unbelievable scars. He said, the day I did this, he said, I had been feeling down for a while, and I'd had ups and downs. He said, Mom and my brother came to my apartment that morning, and they were talking to me, and he said, I remember them reminding me what a good job I have, what, all the good things that I have in life and how much they love me. He said, yeah, he said, there was a level at which all of that was making sense. But he said, then after a while I said to my brother, you give Mom a run home and pick me up a coffee on the way back. And he said, when my brother came back, he found me in the bathtub after doing this. And he said, what I want to tell you is that when you're in the state of mind, and he mentioned, that people say you're depressed or you're mentally ill, he said, whatever it is, when you're in the state of mind that I was in that day, he said, and I think all of your loved ones were the same. He said, and I remember, and I've used this image with so many people, that's why I share with you today. He said, it's like being inside of a cast iron bubble. He said, there is nothing that anyone is saying to you. And he said, all those things that you said to your loved ones or could have said, he said, the feeling part of that doesn't penetrate that cast iron bubble. He said, when you're in that state of mind, if the solution to it in your mind is ending your life, then nobody is able to kind of talk you out of it. They may figure out a way to delay it, and maybe there'll be other things happen in the meantime. But he said, when you're in that state of mind, and I remember a man who was in the room breaking down crying, and he said, and his son had died about 8 years before that by suicide. He said, you are setting me free. Because it made sense to him, and it made sense to me. Maybe it made sense to no one else, but I think in some ways it resonates with trying to figure out that state of mind that someone is in when they come to the conclusion that this is the solution to their problem. And sometimes, of course, as we know, they see it as a solution for the world around them. think their most dearest loved ones would be better off without them. So I've had that experience informed me so much, and I asked him if I could share his story, and he said, I hope you will, as often as you get a chance to. But I think sometimes it makes sense, and I think sometimes it makes sense when you're trying to help people who are trying to figure it out, because that in itself really swells.
We are in an iron bubble, and you're saying that can't get in sometimes with the guilt. And I have, believe me, I've intellectualized this a million times, that we weren't responsible in many ways. Maybe we were, I don't know, but you can't help thinking, what if I had, sold the house and said, we'll make $150,000 on selling our house, and we'll go to the States, and I'll take Louis down to the OCD clinic that's down, what if I had said, I didn't do that, we didn't do that, but those things you can't help, but I mean, that kind of goes away a bit, but it's very, very hard to get through that message, and it's like, I can, look at those lists, I can do that, I go through that, I'm not sure if it's 20 times a day or 5 times or 10 times, depending on the day, and I go in a circle of that.
I try to take out blame and shame and anger because I don't think it's, I feel it, but I don't think it's fair.
No.
You're not in control.
That's
you don't have it, right?
Yes.
All the rest you got, yeah. Although, and I have all those too, but I try not to listen to them.
The other thing too is that some things happen and you are people of faith. Something happens where you suddenly say to yourself, oh, this is the world. This is life. This can happen. This boy, this person you love, this center of your life can, first of all, which every person goes through, this grief of when you realize your child has a mental illness or a disability sometimes, or whatever, that is the world. And, the worst thing imaginable can happen and has happened. So suddenly, oh, I get that feeling when I say, oh, this is the world. This is what life is. And that's the thing that, I don't have direct kind of spiritual things, but that's maybe where you guys can help too, right? And that's outside the thing that you don't feel guilty, but you do feel that is reality. That's where I would say you need help, a lot of help. For a long time too. This is 3 years now. We're saying 2.5 years actually. Yeah. And I think there is a little tiny difference. I think our grandchild made it. I really felt when I was there, I thought, yeah, this is making a difference. Maybe in that idea of that this also can happen in this world, right?
So in the midst of death, there is new life. And that's critical. Thank you for that, Andy. So I want to move into trauma and give you a couple of pieces of information. Trauma refers to experiences or events that by definition are out of the ordinary in terms of their overwhelming nature. They are more than merely stressful. They are also shocking, terrifying, and devastating to the victim, resulting in profoundly upsetting feelings or terror, shame, helplessness, and powerlessness. And so when you meet with someone who's found their loved one hanging, or their loved one has just taken 100 pills on top of alcohol, and they try to do resuscitation of some kind to bring them back, and it is horrific. It is horrific to their nervous system. So that the quote at the bottom, a nervous system responds to threat. a protective impulse that didn't have anywhere to go. That is, it needs direction. So when a person experiences trauma, there's a body impulse. And if that person is not able to direct it, then it stays in the body. It's stuck in the body. And so this is very, it can be very complicated, the treatment of trauma. And so and that's why we now in Eastern Health, we have a service called Trauma Stress Services. And I refer to that agencies sometimes because their waiting lists are often up to a year and sometimes greater than a year, which is really unfortunate. So that's why in this session I'm hoping to be able to help you to see what you can do rather than, and as Rick mentioned, you know, the referral is appropriate, but yet you also have to do your part and maximize your abilities. And so, you know, knowing and hearing from Andy especially of how far I go with people, and I've had people say to me they've gone to trauma stress services after a year of waiting on the wait list, and they say, I don't need that, I'm coming back to you. And I say, great, that's fine. You know, so that tells me I'm doing something right. And so it's a case of what is it that you do or that you can do that creates a space and creates a community, as David was talking about, there's a space, a loving space that a person can feel at home in. And what Andy and Mary Lynn are saying in reference to their granddaughter, how that granddaughter is changing their lives, changing their community. She represents new life. The cycle of life is birth, death, and rebirth. And that's, I'll talk in a few minutes about Warden's tasks of mourning. And the last one is using your energy in new directions. Well, Andy and Mary Lynn have a granddaughter that they are now able to invest energy in. And that's creative energy, that's new life. And we need to help people have those relationships. And so in a congregation, to have people who sincerely say, I don't know what to say, but I'm here for you. Like that's tremendous. That represents new life. So that's a definition of trauma. And another, trauma in grief, I want to focus on the trauma of grief, is a complicated process which makes it difficult to cope and integrate the loss into one's previously held mental, emotional, and spiritual framework. A complicated process. All grief is complicated to some extent. Every person's grief, and the way we grieve, the way I grieved my father 20 years ago compared to how I grieved my mother 4 years ago is very different. So it's different within our own experiences. It's different with every single person. Grief process is always unique to the person and to the person who has died. So it's a complicated process which makes it difficult to cope and integrate the loss into one's previously held mental, emotional, and spiritual framework. And so I want to say to you something that I believe I'm learning, and that is you have opportunities to help people on spiritual pathways that they would never have gone on had they not faced the trauma or tragedy they are experiencing. What this is saying is their previously held mental, emotional, and spiritual framework doesn't cut it anymore. And that's what Andy said a few minutes ago. He said that, you know, like he could focus and plan, and even though he may never get to it, he felt good, he could get on with life, the sadness or whatever he was experiencing would lift, and all would be good. but for 2.5 years, it's just a framework. The old framework doesn't work anymore. And so the grief and the trauma go together. We have to be aware of both in this situation. So trauma and grief makes an intrusion by its violence and its consequences. It's violent. Unfairness, complexity and disenfranchisement, suddenness and randomness. The number of people who say, this week I thought I like to write poetry, and I thought there's a poem that's coming that only the good die young. And I thought about that, and I thought, gee, people, they say it's a throwaway statement. You've heard it, I've heard it, only the good die young. Well, maybe those who we term as no good or as evil or whatever word you want to use, maybe they've learned to give themselves forgiveness and understanding and acceptance that others who appear good haven't learned. So that's kind of a different way of looking at it, but it's saying that when we're faced with these kinds of questions, these kinds of grief challenges, then there's a new spiritual path here. People need to know a God or their God in a different way. The God that people say, oh, he took or she took my loved one, that they feel repulsed by that God. And so how do I help people to discover a different way of faith, a different approach, and a deepening of faith that they've never had before? It's a tremendous opportunity. That's the way I see it. I see it as an invitation to help somebody make sense of life that they could not have, that their old framework doesn't cut it anymore. So the role that you have to play is profound. I tell people, I feel so privileged to be in the job that I'm in, because I do more spiritual direction today than I ever did in my previous ministries. Like that's significant. I do more spiritual direction. Like, I think, Andy, I think I can honestly say I do soul work with you.
Absolutely. Yeah.
And yet, there's never any mention. I don't proselytize. I don't think I mention God, or I don't mention Jesus Christ.
I didn't even know you were a priest for 6 months. I never even.
So and that's not. I don't deny it. Like, I'm out there. My name.
He denied he was a priest.
But it's my name tag everywhere. I put it out there. I don't make any apologies, but I'm saying that the spiritual journey is so inviting. I'm not, it's not. I don't like. And I'm sure you're not taking me wrong, but I do want, I don't go looking for tragedy. I'm not a masochist in that way. But I'm just saying that it is hard work, and journeying with people who are grieving, and especially those who are grieving by suicide. And so that's why my heart goes out to you, and if there's any resources that I can help provide, and I plan to mention to you that the support group in the city called Survivors of Suicide, they now have a house, and so all the meetings for survivors of suicide are happening in a house near Mount Monday Pond that's devoted for survivors of suicide. It's come a long way, and since the days, I think, when Sharon Barnes helped start that, it must be 25 years ago, through the Waterford. So but it's to just say that trauma and grief go together, and it's very, very serious. Complicated grief. Complicated grief, assessment criteria including multiple losses, tragedy of the loss, mental health concerns. We have a tool called the Bereavement Risk Assessment Tool. And that tool comes from Victoria Hospice in British Columbia. And so the indicators or symptoms for complicated grief include multiple losses. So I listen for, why is someone coming to see me? Why do they need services? Well, if they have more than one loss, then they're at risk of unresolved grief, and that can be a key for a clue for complicated grief. Child death. There's always complications, I believe, around child death. Mental health issues. Now, somebody who has mental health issues may have a tremendous support team, and their healthcare team may be doing a fantastic job, and so they'll help, with the help of that circle of support, they process their grief and they do quite well. So not everybody that has a mental illness has complicated grief. Those are three.
Circumstances of the loss usually.
Yeah, the tragic, traumatic loss, like suicide, like a onset of an illness. The group I do on Tuesday, the second Tuesday of the month at the Miller Center this past week, 2 families were there whose loved ones were only sick about 5 weeks, and then they've only been grieving that death, that sudden death, for 5 weeks, and so that in itself can be an indicator of complicated grief. But if
Peter,
it's
let me just
sustained,
ask you to comment on multiple losses and I suppose the concurrent stressors sometimes referred to, but like losses are not always a death either. People have a marriage breakdown or job loss. I mean, you mentioned the likelihood of suicides this year and the economy, and there's
exactly.
graphs and statistics often show the correlation between shifts in the economy. But I'll ask you to comment on that aspect.
I listen again for other losses, and in my intake form I ask, what are your losses? And I don't just refer to deaths, because that can very much, like somebody, I can remember, I've been in this position 6 years, and one of the early referrals I had, because I wasn't getting all that many referrals because I wasn't known at that time, but there was this one young fellow who came to see me, was a student at the Murphy Center at the time, and he had broken up with his girlfriend, and he was immobilized by that, and so like that's those losses, the family, and so sometimes people will come, and the death is a secondary loss compared to something else that's significant that has happened in their life. Thank you for pointing that out, Rick. Often trauma needs to be partially or totally addressed before working through the grief. And that phrase is so critical, because, as I said, the reason I've become so aware of trauma is because I felt like I was spinning my wheels. So what I ordinarily, the approaches that I take, and I use William Warden's approach quite often, and I use a narrative approach, and I use cognitive behavioral therapy, and all of my bag of my toolkit. None of it was working, or none of it works when a person is immobilized by trauma. And so then the trauma has to be addressed in some way, or all the efforts just seem to be in vain. And so that's how serious and how critical trauma in the face of grief is for us. Learning skills to look but not linger. To look at the trauma but not linger there. In terms of the nervous system, what we need to do is help a person to be deactivated. And one of the things I've found lately, and I probably should have a slide or a handout for it, is a term called oscillation. And so people in their grief oscillate. And so you might think that, oh, if I can only get them away from focusing on their loss. Well, that's part of the oscillation. They swing back and forth. And that's a normal process of grief, to experience that, what we call restorative orientation and loss orientation. So you get, and it's called the dual process approach to grief. And so your person oscillates between the loss orientation, but not to linger there. That's the key, is to encourage people not to linger there, but to swing back again to the restorative orientation. So that's why I use that. What is healing presence? How do you bring or allow healing presence, creating space for healing? And I just want to try something. If you could turn to the person next to you and share with them how you experience being a healing presence. You know, in your careers, in your vocation, or as parents, or as family members, you can be a healing presence. So in Diaz, just for a couple of minutes, if you would share with one another how you see yourselves as a healing presence. You made three.
Changes that their tells. Like this person that they broke all over people's heart.
It's been a way to
really make us turn up
And the space that other people space. They come with a lot of
So can I bring you back, because people online are probably bored to death, or Susan or Linda and Janet, you bored to death?
Peter?
They've gone asleep.
No. Janet and I did the exercise. At least we had a buddy with each other.
Good, thanks, Linda. Are they the only two that are online, Rick?
No, six sites, huh?
Oh, great. Well, welcome all those. And those that are online, please feel free to interject, because it's often hard to be aware that you're there when we're focused on each other here. So.
Right, and I'll just mention that we don't take a break while we're recording for the benefit of those who will be viewing it online, because we can't stop and start the recording again. It starts second recording. But there's coffee, thanks to the host. Thank you very much, Greg, for the hospitality today. So if you want to go and grab a cuppa on your own pace, just do it. Just don't make too much noise with the chairs, because it'll be recorded as well.
Thank you, Rick. And those that are online, you'll have to experience it vicariously. So, so how are you a healing presence? Does anybody want to share ways that you see yourself as a healing presence?
Yeah, Greg, the tool that I always use, I guess, if you call it a tool, is empathetic listening. You know, when I'm faced with any kind of a pastoral situation, grief or trauma or anything else, is always trying to listen with your whole being, to the extent that you can, while you can't say that you know what they're going through, at least you can try to understand to some extent what, and identify with what they're feeling, hurting. So empathetic listening would certainly be at the top of my tools for creating a space for healing presence. And I guess the other thing for me personally is that we lost a child, even though it wasn't through suicide, but we were certainly faced with similar trauma. When we told our third daughter after she was born, she'd only live a few months. So that was and some of the stuff that you're talking about here today, of course, I can relate to a lot. And so I guess that experience for me, I bring that into all my pastoral situations, because I'm trying to identify, when they talk about things, I can identify with some of those things that people are going through, particularly when there's loss of a child involved. So it's, I guess, that personal experience that I bring to the situation, and being able to identify with some of their pain.
Thank you for sharing that, Greg. I remember you at the Waterford years ago, and on the developmental disabilities unit, and using your instrument there, and how I could see then that you approached your care through your heart, and that is so relevant and so important. So thank you for sharing that. Anyone else? But what Greg is saying is what I've been trying to emphasize, is that these are to be aware in your own gut, in your own heart, of the intuition that you have. Listen to your intuition. Listen to your own soul. Listen to that which stirs you. And people feel that. People know that you're different because they can see it in your eyes. They can see it in your face. And so that's why it's so critical, I think, to acknowledge how you are a healing presence. And how then do you foster it? Like the third part of this presentation, which I doubt we ever get to today, but anyway, that's no big deal, but is the self-care, and how do you foster that healing presence within yourself? And I think that's, again, what Rick said, there'll be a session on wellness. How we take care of ourselves is a critical piece of that. David.
I give it to me. I find that with this topic, I find it is like almost a wound that will never heal. And I realize there's a need for that to be never healed, because it's so real. I've been a first responder probably to 12 suicides in my career and vocation. And the last one was 3 years ago. And a friend of my son parishioner, and so real, and watching myself as I broke down the door of the house, and my son raced down the stairs, found him, had him down, and seeing the trauma now going through to my son, watching and then dealing, and minister, continuing to minister to those who were present immediately at that time, and the girlfriend and parents. And I find there's an immense anger in me, an immense anger that moves me to say, we've got to do something, we've got to make a difference.
Yes.
And the space that we create within the community, the worshiping community, is part of that anger that moves me on. I've had 2 friends whose sons have killed themselves, and with them, an incredible paralyzing sense. I could not respond. It took me 10 years to go and see the mom, the first, and 8 years to even send a text to my other friend. And it was just like, wow, I who've been a priest, a pastor, who deal with this and have dealt with this, could not do anything, just paralyzed. And realizing that the healing presence I have is an intervener and a pastor within my parish, but I'm absolutely inept as a friend, absolutely inept, and that's incredibly humbling and distressing at the same time.
Wow.
And I see this as the wound that should not heal, because it causes us to move to say, what do we do to make a difference? How do we not let this happen, needlessly?
That's the old concept of the wounded healer gets on right now.
Yes.
Yeah. So that's part 2. No, part 3, I'm sorry. We'll tie it in next. We'll tie it in with the wellness. Just want to note that one of our colleagues, Jeff, is on from, is in Toronto today, but tune in from there. Welcome. But he sends a note here. The platform I'm using allows for chat on it as well. But he's mentioned a place of silence, being there, and sometimes brought to prayer and reading scripture and so on as well. But that healing presence and silence as being a powerful conduit is something many people mention. Thanks to Japheth for that.
Could I just say something here? This is Andy Jones talking here. The other thing, when I heard what you were saying there, I realized, because of the work that I do too, as an actor and as I do workshops and stuff like that, is that, sometimes you guys have got to realize how many resources you bring to a situation. You have to have faith in yourselves. You have, because of your role, you've met so many people who are in stress. You've met so many people who are in difficult situations. You've been trained, you've done courses, you've stuff, but also just your human experience is that you must have the faith that when you go into a situation that your creativity will click into place. I think that's really important. So, just as a way of giving you confidence to say, I'm going to go rush into this, I'm going to not rush in, I'm going to go into the situation. And that, you do have a lot of experience. And that, I try to do this in the workshops that I do too, right? But that you have, that what will come through will not be the plan that you have for that day, but it will be your creative response to what comes up in the session that you are with that person. Anyway.
Thank you, Andy. That's well said. Trust your gut is what, yeah. And
Can I briefly share something that happened to me when my husband died? I had 2 phone calls, one from my godfather, who was a padre in the Canadian Army, and the first thing he said was, Elizabeth, I don't know what to say. And the second call came from my cousin, who's an archbishop, and the first thing he said was, Elizabeth, I don't know what to say. Those things aren't helpful, as I reminded both of them, because I knew them very well. It's better to say something that I wish I could understand how you must be feeling. So this is just a tip for if you're phoning or seeing somebody as clergy. Those things, I had hundreds, literally hundreds of phone calls, but those two stand out in my mind as two people I expected to say something healing or understanding and didn't. And they will never do it. Well, Gordon died, but they will never do that again, because I warned them that that was not appropriate for what I was doing. And it came very early on, the next day after my husband had died. So that was something that stuck in my mind, that it would have been nice if they had been a little more empathetic.
If they'd been a little bit more trustful of their skill set. And
that would have been good.
Yeah, exactly.
Yeah, exactly. As Liz, by the way, anybody who's on the other end of the line, I forgot to say. But
there's a balance here, though, isn't it, between having confidence in our abilities to intervene in that situation and also having the humility to recognize what our abilities and limits are. And I think we always have, I think there's always that tension, and maybe that's the oscillating, the process that you're talking about.
Well, the tension is the ego.
Absolutely.
Like, what is expected of me compared to what am I capable of? And that's what Andy was saying. Have faith in yourselves.
Can I say that we were thanked immensely many times and are still thanked on a regular basis just for acknowledging Louis' death and how he died and putting it in the paper and talking about it. So just by acknowledging it to the people you're counseling, just by acknowledging it, you're giving.
You've both been very brave about it. You have courage beyond anything that I could possibly have.
Well, thanks for saying that, but I never think of it as brave. Well, think of it as the truth.
Listen, from my point of view.
I will never forget. I wasn't at the memorial for Louis, but I can remember the clip that CBC ran with Mary Walsh when she did the eulogy, and she said if Louis had died of cancer, he would have died surrounded by family. Because he died of a mental illness, he died alone. And I'll never forget that phrase. It was so powerful to me. And so, yeah, thank you to Andy from Mary Lynn for what they do in our community.
I felt like looking back at it now, I was doing the same thing that somebody is. This is the image. I have a different image every day, but it's like the plane is going down, and you look at the person next to you, and whoever they are, never met them before, maybe you're taking a prisoner to jail, who knows? At that moment, you reach out and you hold that person's hand, and you have the deepest relationship you maybe have ever had because as you're about to die. They'd be playing, But that's what I felt like. I felt like I don't never think of myself as brave. I felt like I was going like, please. Just help. I couldn't believe this was happening. So that's the image.
And we did get surrounded. The community was brilliant.
Yeah.
We got a lot of help.
Yeah, and actually in the world of religion or official church, Reverend Guy Matthews at United Church was fabulous to us.
Yeah.
But I think that's Lynn Courage. I think that's important too, what Mary Walsh said, because it was 18 of us that go around together. There was a group, and now there's 17. One of the guys committed suicide 2 years ago. And I was the one who went to the house and dealt with all that. I mean, I've known this family for, 30 plus years. And me pastorally, being a friend, and then being the clergy, trying to, work that out. And all my friends that night, they all got together to go around and share Jeff's life. But I couldn't go there that night because I was in a different mode of being the person that I needed to be for the family. But when we got to share, it's different. If Jeff had had cancer, the conversation of my friends would have been totally different than because Jeff committed suicide. He committed suicide in his house by hanging. And watching my friends go through all the process of their guilt, their anger, and everything, because there was no inhibitions. They know me so well. Because sometimes we walk into a person, if I had gone to your house, we don't know each other. And maybe you might be guarded by some things that you want to say. But me knowing these people for over 30 years, everything was coming at me. And, you know, trying to process that. And I remember one of the girls there, she said, I am angry because I went through cancer. And I fought and fought and fought to live. And here he committed suicide. How dare he do that?
Exactly.
You know?
Yep.
And some people, that's where she came from. And it took her a while to process that. And you hear, all the things that you hear was, he had so much to live for. He had 2 daughters. He had this, he had that, and something else. Yes, all that was true, but you have to deal in the reality of the present that we have now. And it's no good to say what he would have had or what he had, but he was suffering himself inside. And to try for people to understand that his grief, his suffering, his sorrow, his pain was so real to him that they could not understand that. And I still have difficulty understanding that. And then the guilt of the group saying, my gosh, you know, if I had taken Jeff out that day for a coffee, he wouldn't have committed suicide that day. Or his father-in-law said, I go up there every morning. Jeff called that morning and said, I'm homesick today, don't bother to come up. He didn't want his father to come up because he didn't want his father-in-law to find him. You know, I firmly believe that. And how the whole process of that day went out. I think he thought it through. He knew what he was doing on that particular day. That's only my opinion. And because I believe that he had a plan, and that's what he intended to do. But for the whole scope, so several things that we did as a group this past summer, we had a video that we did 25 years ago. And we played that video. We laughed, we cried, we did it all. Jeff was in the video, he was drinking, and he was laughing and carrying on. And that's the guy that, you know, we embraced. The guys go up to the cemetery, they open up a beer, they toast him, and they have lots of fun that way. We get together with his wife, she comes to all the things. And as a single person coming back into the group like that, that is very difficult to do. Because we're all couples, we're all in our 50s, we're all young. And so the whole process of that has been very interesting for me to go through as a friend and for me to go through as a priest as well.
Thank you, Lynn. And what I hear you drawing attention to is how do we enable and encourage people to live with paradox? Like that's and I think in terms of faith development, learning to live with paradox is huge. Things can't be black and white. And so that's why I say to people, I get to know so many dead people intimately. That sounds absurd, but that's the truth of it. We have opportunities through loved ones to know a person, and that's part of the healing presence. So the next slide is why healing presence matters in bereavement. When one is truly present to another, there is an alleviation of loneliness, an affirmation of one's authentic self, and an invitation to wholeness. Potential for spiritual bonding, the deepening of spiritual bonding. A deeper sense of our common humanity, a recognition and acknowledgement of the other as person. An invitation to self-transcendence, possibility for greater self-reflection and self-revelation, sharing on a deeper level, a spiritual level. So that, you know, healing presence in bereavement is so critical, and especially in relation to death by suicide. what is, backwards. To honor the person's grief, meeting another where they are at in their grief process, their emotional pain and suffering. Meeting a person where they're at. That's the vulnerability one of you were mentioning. I think it was you, Greg, said how you had to acknowledge your own vulnerability. And that is critical, I think, in terms of honoring a person. And they can appreciate that. The tasks of mourning, this is probably not new, this is probably old hat to some of you. I like to use this in terms of assessing a person's movement through their grief, and that's the tasks of mourning, and it's action oriented. So to accept the reality of the loss. And you got to distinguish between the head acceptance and the heart acceptance. There's one woman I see whose son died tragically. He had a chronic illness, but she was shocked by his death. And it was 11 months after he died, and she came in my office and she said, "Do you realize he's been dead a year next month?" I said, "Yes," because I'd been seeing her most of that year. And she said, "I thought it was 2 weeks ago." And she was straight. That's what she felt. It felt like only 2 weeks. That's how, but that she was starting to really feel it. And I think Andy and Mary Lynn, that's what you described in terms of the first year. It's been the second and third years that have been the greater challenge, is because, recognize your breath, recognize how this, in time, the body is a wonderful instrument. It's a wonderful how it cares for us. And so the full shock of a death by suicide, our nervous system just can't handle it. It's overload. It's like a windmill. And I was exploring having wind power at my cottage, and the engineer I spoke to said, "The wind there is too great." I thought, "Why?" He said, "Because it trips it out." And that's what our nervous system does. We go into shock in order to preserve ourselves. That's how serious it is. But then in time, a person needs to be coached and helped to I don't know if you have a dog. My dog, he often shakes himself. And that's regulating his nervous system. And sometimes when I lie down, my body, and it's good. We're now realizing that paramedics oftentimes try to strap people down to stop them shaking, when in fact the body needs to shake. It needs to regulate its nervous system. Tasks of mourning, the first is to accept the reality of the loss. The second is to experience the pain of the loss. The more you can acknowledge the pain a person is, and so if you can go inside and acknowledge how you might feel and name that, and share how horrified you are or how angry you are, as you just said, Lynn, like that's critical. The person then knows, yeah, he or she gets it. They got it. So experiencing the pain of the loss, adjusting to the environment where the person is missing. And there is no formulas for that. So some people give away their clothes just like that. Some people get them made into quilts. Some people put them make shirts into pillows. All kinds of things are done with people's possessions. And so it's what that enables them to adjust to the environment without the loss. I have a coat belonged to my dad that I wear every winter because it's a nice down coat. It hangs in my closet. I always know it's Dad's coat. That's what it is. It's a sacred object. So people need sacred objects. And withdrawal of emotional energy from the deceased and the reinvestment of that energy in relationships and activities. And so that's really important. And so I think one of the key pieces of grief work is, what would your loved one want? Some of you may have heard of the Spirit Horse program that's done in memory of a young lady, and that program is her legacy, and that's very important to people. So that's the withdrawal of that emotional energy and reinvestment. And I think, Andy, you and Mary Lynn, that, you know, you talk about your granddaughter. That's the new life. That's investing and encouraging people and encouraging parishes to have groups. Church of the Resurrection, where I worship regularly, is we have a monthly bereavement support group. But you don't have to replicate all of those things. In Eastern Health, we have a spousal support group now that meets every Monday night. There was 7 people last Monday, Thanksgiving Day, at that meeting. Thursday nights, last night, tonight rather. Tonight, there's a group for adult children who've lost parents that meets at Daffodil Place. So these are activities that I want you to know about, and I'd like for you to advertise so that we do this and run groups. That's certainly a great help to our community.
Could you list or send David an email on the groups that you run, and then he could send it out to all the parishes? Could you do that?
I think it's sent out to Eastern Health already.
Okay.
Yeah, I think Meg Snook is our admin assistant. She's doing a marvelous job. Our website, our intranet, that's internal website, is quite good. The internet is not there yet, but we have all of those things listed. It's just that it's coming to be announced. But Lynn, just call the office, call Meg. It can easily, you know, we don't mind sending out reminders. That's, okay. Yeah. And Jean is gone, but I'm doing a presentation next Tuesday night in Upper Gully, so I'm sure there's going to be seats. So we can add more seats if it gets crowded. Task of the morning, attitude of healing presence, an attitude of anticipation that you bring to a relationship, the anticipation of making a difference, of something changing because of the connection, engagement, the relationship. An attitude of healing presence. Have faith in yourself, as Andy suggested. Believe that even in your quiet, even in your intentional healing presence, there can be profound impact. The cave. I like this quote from Carl Jung. The cave is the place of rebirth, that secret cavity in which one is shut up in order to be incubated and renewed. To see grief and trauma and suicide as an opportunity to grow with someone, to help them through that cave experience. It can be transformative. There's a whole new theory base that's called trauma. Traumatic growth. The whole idea of people growing through trauma, like the endearment, Louis and Mary Lynn, you have experienced from the community. Like, nobody wished that Louis died. Nobody would, you know, if we could only bring him back, that's what we would do.
Can I also say, because I think it's so beautiful, that since our daughter got pregnant and was having a baby, so many people in the community are so happy for us because of that baby. And we're feeling it. And we know that Franny will never replace Louis. But people are so happy. Yeah. And it's been lovely.
It's because of Louis, yeah.
Yeah.
So they shared your sorrow,
yeah.
And now they're sharing your joy. Oh, the spectrum is wide, and that's fantastic. Yes. Thank you for sharing that, Mary Lynn.
Peter, I think for me personally, that slide is really the visual that I connect with, the cave. And when I was here, and a 4-year-old child who was one of a twin died. And that mother, well, the couple together, but the mother just she just went into that cave that went on and on and on for year 1 and 2 and 3, and it took a long, long time. And when I think about the support offered by caregivers, I knew the family well, so we would go to their house and whatnot, and she just was totally immobilized. And it was a fear that they would even lose their business because he had to look after everything. And our son at the time had been a babysitter for them. And that Christmas, she could not do Christmas. And the husband managed to get Santa Claus bought and all that. And he went up late at night with her in bed and wrapped all the gifts and got everything ready to be under the Christmas tree and stuff. And he was like a 20-year-old, 21-year-old. And to hear them reflecting now, to have seen that they survived, because I used to come home sometimes and say, I don't know if Colin by name is going to make it. Sometimes I came home she's just too far gone. I don't know if she's going to make it. And and she did make it, but she had to survive a lot of difficult things being said to her. In her grief and the family's not knowing how to help. Another child in the family was disabled. And someone actually said, it's too bad it had to be so-and-so and not so-and-so. That was really said to their face. And that just put her totally down if she was moving this inch. And things like getting really angry and saying, you're selfish, get over it, you've got 3 children to live for, and all of that. And when on the flip side, simple things that made us help in that long journey was going up and wrapping Christmas gifts.
Yeah.
So that Santa Claus came the next morning, and that wasn't the guilt that she had carried in her days later, that Santa Claus didn't come because she was too sick to be able to deal with it. And it's reading that today, I know that she was in the cave. And I know beyond a shadow of a doubt through a rough journey, and little what might have appeared insignificant things made a big difference in slowly, that you couldn't see, she was able to rise out of the ashes. But we really have to be patient and sometimes accept that we can't fix it and make it better because the time frame is over. And a year is over, or 6 months is over, or whatever is over. And so I would like to get a copy of that page because I think it speaks for some who go in. Everybody goes to grief, but there's those who go into the really and got to struggle, and I'm trying to get out of it. And that's a helpful one for me.
And that's why I'm drawing attention to the trauma, to the shock, and how acknowledging the pain that Andy and Mary Lynn are experiencing, and because of that is so profound. But then to try to see this as a place of incubation, and it is a place of incubation, especially for Franny. Like she needs you, and that motivator, but it has to be in the right time. It can't be forced. It's like the butterfly. If you try to force the butterfly out of the cocoon, it dies. It has to get strength from pushing and breaking breaking the cocoon itself. So that's why it's so important to err on the side of being a healing presence than on the side of being a fixer. There are no formulas. Can you stand in that cave, in that darkness with a person for a long period of time, is what you've said, Sandra.
Oh, yeah. That's a good thing you said, is you can't be a fixer. There's no fixing. Yeah.
You didn't make the problem, so you can't fix the problem.
Yeah.
It's not yours. Can I just briefly talk about grief for 1 minute? It's not suicide. But my cousin died 3 weeks ago, and we were very fond of him. And his brother and I have been looking after everything, and my son. And our grief has fixated on his cat. And this cat was a dear little cat who cuddled up with him on his wheelchair for many years. And it's an older cat. We're trying to find a home for it. But it's funny because all our energies have been focused on the cat. And it's a sweet little cat. Anybody knows anybody wants a cat, you know. But it's just such a it's a good way to focus our grief, because the cat is very alive and very feisty and very responsive to us. And a reminder of the guy we lost. And I just thought that might be helpful to some of you, because other people leave dogs and cats. You see it in the obituaries in the paper. And sometimes that might be the way into helping somebody with a family who sees someone's cat left, or dog, or hamster, or whatever.
Thank you for that.
Small, but...
So also on that slide that Sandra has been enthralled with, it says, can the support offered by caregivers be the cave? Can you help create that safe cave, that place of rebirth for suicide survivors? Can there ever be letting go and new life after suicide? These are profound questions. Why? Answers, no answers. So I want to move now to the discussion, how I can begin to appreciate the world or life as others see it. How can I come to appreciate the world and life as others see it? You know, some of you are involved in the care of Syrian refugees, and I commend any of you who do that, and I think the faith communities across this country who have been supporting refugees' families are fantastic. But a lot of these people have been traumatized. If you are ever in a war-torn area, it is profound what they experience. So that all of those dimensions of trauma is so real to us in this community. So let's open it up for a few minutes of discussion, and also paying attention to those online as well. Any questions or comments? Like, I've invited Andy and Mary Lynn especially to be resources to us. Has this first part, this first section, spurred anything that you really want to explore together at this point? Anything that stands out so far that has been a surprise to you, even something you didn't expect to hear that you've heard? Or have you made any aha moments, that creativity, that inspiration that may have come to you?
I think that
your name?
Oh, my name is Julie.
Julie.
I think in my experience as clergy and as non-clergy, like over time, one of the things that I do when I'm entering into places and spaces of grief and bereavement, whether it's, organizing programs on grief, or whether it's walking into the doors of the funeral homes, or entering into the homes to the kitchen table where we are usually greeted by the victims' families. One of the things I find myself doing is that we all wear collars, and that gives a visible identification of, to some, who we are. But one of the things I've found I've started doing recently is I take my scarf and wrap it around so that that collar isn't quite visible to the people you're going to meet for the very first time in the very place where they're hurting the most, in the cave or at the kitchen table or just inside those doors of a funeral home. And I've also learned for myself to, when I enter in, to go in very gently, take in with gentleness, even within closing the door behind me. I'll close the door with the weight of the door on my physical body, because that's almost a pressure. You feel a pressure there, but it causes you to enter in gently so that you're not disrupting anyone's place where they are. I feel that I don't want to be disruptive. You want to be as gentle and calming and with your voice, and you need to somehow, when you're going into these groups of people, for the first time you're meeting them, you don't know who is who, and I tend to work from the periphery into the center, where that's in the center is where you find the people who are hurting most in groups, in family homes, and in, you know, the places and spaces that we find ourselves in. With suicides, I've attended families who know that I'm clergy and who know that I'm not clergy. And I don't find any difference in how how you communicate or how you relate or how you enter in, because the habit I've developed is always with the most gentleness of steps. You know, to have that in your voice and in your heart as well, to be as gentle as possible. It's gentleness.
Thank you, Julie. And that's what I think, you know, that's what we've been talking about in terms of the healing presence, to enable you to be that healing presence through your gentleness.
I think that underscores how important is feeling comfortable with, you know, dealing with people in intense grief, especially in the early phases when you talk about going through funeral homes and that. But for the whole way through, when you're dealing with people with complicated grief, particularly the death of suicide, I mean, you have to make yourself as comfortable as you can. And part of it is acknowledging that I'm entering into really a zone of mystery. But that can be a sacred experience, and you can not only use that as a way of kind of settling yourself into it, but it's what you will bring to people. And you know, so some of the things you mentioned there kind of reinforce that. And it is a unique role that you have in pastoral ministry when you reach out to people. Many want it. Some are probably resistant for one reason or another. But many, they're just on a, you know, they feel so lost in the intensity of a sudden death, particularly suicide, that they will test the waters usually with pretty well anyone and kind of get a sense, is this giving me any sense of bearing at all? Is it fitting in with what I'm trying to integrate? And so being a bit comfortable with it yourself and comfortable with the fact that I'm not going to go there with quick fixes or, you know, and engaging the cliche statements, particularly ones that pertain to God's will and that kind of stuff, can be very off-putting to many, and so, you know, you've kind of brought that into it. Peter, we'll take a few more questions and comments, and then we'll need to sign off.
Great.
I'd just like to answer your question there. How can I begin to appreciate the world of the life again as the people kind of experience it? And probably to our couple here today, and again, even though you know, I didn't lose a child through suicide, you know, the whole experience changes you, and it transforms you. And it's a very lengthy process. And I know for me personally, talking about confusion and disorientation, I was consumed, preoccupied in the early days to the extent that I was in danger of driving on the road, that sort of thing. But, you know, after our child died, in fact, she was almost 8, so we were very blessed to have her for 8 years. But one of the things she really enjoyed, and she was a special needs child, and she had difficulty communicating. But one of the things she really enjoyed was me playing the accordion, button accordion. So every day I'd come home from Queen's College, as soon as she'd see me, she'd come towards me as fast as she couldn't move very fast. All smiles, and wanted me to sit down and play a couple of jigs on the accordion, which I did. And of course, she'd just sit back in our little walker that she had, smiles and tap her little fingers to the tune and things like this. So after a couple of tunes, she had enough, and that was it, she went on. But after she died, for full 12 months, I couldn't pick up that accordion. It was still under the chair. And one day I realized that, you know, I can't live this way anymore. So I remember coming home from Queen's College one day. It was towards the end of my training at Queen's College. And I said to my wife, I got to pick this up and play it. And I did, and as I played it, the tears just kept coming. But it was a hurdle that I had to get over. And of course, when you lose someone, and I can't imagine what it is losing anyone through a suicide, we're going to be faced with every day there's different hurdles. And I just found myself that, you know, in order to get past that hurdle, I had to face it and find my way around it, under it, over it, whatever it took. And I think in the end, you're a different person, but you appreciate life all that much more. And I suppose that I like to think that's some consolation for you. You'll never be the same. You'll be different, but you'll be deeper. You'll have a deeper spirituality. You'll have far much more appreciation for life. Amen.
Thank you.
Yeah.
Thank you, Greg.
Well, I think that's a great way to wrap it up, and appropriate that it be a personal sharing from the host to today's event here at St. Thomas's. Greg, thank you for that contribution and for the hospitality today. Peter, you.
Thank you, Rick.
We just don't know what to say to thank you for what you've done today, Andy and Mary Lynn, and what you've done over the past 2.5 years, and what we know you'll continue to do. I participated in research years ago. It was very broad-based across North America, but it was really looking at what's effective in grief for people. But anyway, one of the things, a focus of our study was people who had lost a child, and it was with people who had had a death not less than 5, not more than 10 years, parameters of the study. But what was interesting is the vast majority admitted that the death of their child was the worst thing that ever happened to them. But the vast majority also said that they would have to admit that in spite of it being the worst thing ever happened to them, they were better people because of it. You know, that rendering that happens in what's important and kind of connecting with values that are deep within us and that come from elsewhere. And I think you're doing that not only for yourselves, but for many others. You're making the world a better place because you're engaging with people and giving them a glimpse, if we can say, into the life of what it is. So thank you so much for what you're sharing with us here today and with many others. And thank you, David Pullings, for asking us to do this and allowing us to do it through your Archdeaconry meeting, but also as a continuing education event for the clergy in the province. And we have good uptake. We'll be recording it and having it online. And as I mentioned, we have 2 more in the fall, one on coping with the holidays and one on clergy wellness. You'll be getting the notes on those. We, like everyone, will send you emails and newsletters and those kinds of things, but spread the word on them. And we thank those who attended who were not only from the Archdeaconry, but others who picked up on it from the communications we sent out from Queen's College and through Queen's College. Thank you for attending. So we'll wrap it up here. We'll go off the air. Thank you to those who have been with us online and those who will be viewing this at a later time at your own convenience. We hope that it's been a good experience and stay connected to us.
Thank you very much, Dr. Britt and Dr. Peter, very much. We really appreciate your comments today, and let us express our gratitude.
Thank you.